The current chairman of the Association of Pharmacists of Nigeria, Dr. Samuel Adekola, has called on the community to believe and trust them more than they trust doctors. Dr. Adekola made the call during an exclusive interview with CEAOAFRICA, when he explained that when people feel sick, the first point of contact they think of is meeting with the pharmacist rather than going to the hospital, especially during this crucial moment when the world is embattling with the COVID-19 pandemic.
The relationship that exists between the community and the community pharmacist is just simple. It is a relationship of trust. The community trusts us, and that is why they want to come to us first if there's any challenge with their health. So we have the trust of the community because we are within them. We are the heart. We are a leader in the community. The community relied on us for decision making. You never get to know this, that majority of time the people come to the pharmacists in the community to play and interact and get their opinions on issues, contemporary issues, political issues. I can tell you, if a community pharmacist tell his client, vote for this person, I tell you, that vote will not be lost. And that's the power of community pharmacists, in the enormosity of community pharmacists in the society, in the community. Because we are right within them and we serve them, they trust us. We are their first point of call. They don't need appointment to see us. At their earliest convenience, we are there to serve them. So the issue of relationship is too cordial. Today, let me tell you, in the current situation of pandemic, the COVID pandemic, people, the burden of a patronage has been very much, even on community pharmacy, because people don't even want to go to hospital. They prefer to come to the community pharmacy.
He says that the fact that most people visit the pharmacy for some medications is an eye-opener that the community have some level of trust for the pharmacist.
In an interview, a research was done in the year 2000, both in America and in the UK, in terms of professional trust. I tell you, community pharmacists come top. Behind the community pharmacist was the clergyman in those nations. And what it simply means is that for somebody to give you drug and use, every drug is a potential poison. So for you to trust the drug I gave to you as a community pharmacist, then it means you trust me. So you can see where the trust comes from. So we had the most trusted professional.
Dr. Adekola maintains that the Association of Pharmacists of Nigeria has been of help to the federal government during the pandemic, as they have donated face masks, disinfectant, and sanitizer to relieve the people of the financial implication involved in the purchase of these items.
When this pandemic broke out in March, early March, even just before March, late February, what we noticed was that there were, prices of items which are incidental to the management of COVID, for prevention, went very high. The price became skyrocketed. Take, for example, hand sanitizer. I recall that I bought hand sanitizer, 100 ml hand sanitizer. I purchased it for 2,000 naira from a supplier, an wholesaler at that time. But of course, incidentally, the same time, I had to travel out for meetings of the International Body of Pharmacy. And the moment I came back, on the 15th of March, I came back to Nigeria. Of course, you may want to know that the first thing I did when I came back on the 15th, because I traveled to Ireland and the United Kingdom, the first thing I did was to take myself to Yaba for testing. And at that time, I had to pay as much as 30,000 for testing. Because I know I'm a community person. So before going into the community, I went for some first one test. And immediately I went for self-isolation. But truth to it, after about 24 hours, my result came back to tell me that I'm negative. It's until that time I had to come out and move to my family. So we demonstrate. That's a demonstration to say to the people that COVID is real. And the only way you can know you are free is when you are tested. That is one commitment we have demonstrated by that. Even while they had me to pay, I did pay. I paid 30,000 naira to them at Yaba. Infectious diseases hospital. And after this, I moved into action by interfacing with several partners, manufacturers, the like of Niprid. I am glad to say that Community Pharmacies was the first organization at the beginning of COVID to interface with Niprid. That's the National Institute for Pharmaceutical Research and Development in Abuja for production of hand sanitizer. But because as at that time, they have gotten no licensure from NAFDAC for manufacturing, after we interface with them, we have to look at other companies on the advice of NAFDAC. We have to look at other companies that have been licensed. They have licenses of NAFDAC. Hem&B was one company that May and Baker, that we partnered with to manufacture and sanitizer for us. And you know what happened? That singular action of ours with M&B brought the price of hand sanitizer drastically down.
He adds that every pharmacist should be called a hero amidst the pandemic because they come in contact with COVID-19 patients, with some of them being asymptomatic, yet they attend to them all.
If not for community pharmacists, I tell you, we will have recorded more deaths. Not death as, that is related to COVID, but deaths that are related to other disease conditions, chronic diseases. If we have been afraid and also run back, that people comes, because let me tell you, it's also on record that we lost some of our members. Yes, we lost some of our members to COVID. It's unfortunate. That's another point. I hear the federal task force talking about healthcare doctors were lost to COVID, but nobody ever says that community pharmacists, not even hospital pharmacists, were lost to COVID. These are people who were attending to people had just a regular, but they didn't know that their patient who comes to them has COVID, and they got. Unfortunately, again for us, was the fact that even while government was trying to provide PPE to hospitals, nobody was providing for us.
According to him, the motto of the community pharmacist is protecting the people, empowering the pharmacists. He laments that with all of these sacrifices, the government seems not to hold them in high esteem, which has been a major challenge to the association generally.
The idea of who is at the front line is not a contention, but because we are in a system that does not recognize everybody, the role of everyone, we don't take healthcare system in Nigeria as a teamwork. Today, federal government will want to set up a team, we want to set up a committee on health issues. You will see out of 10, 8 of them will be medical doctors, and perhaps 1 or 2 persons will be administrators. You will not even see nurse there. You will not see the lab scientists there. You will not see pharmacists there. That is the situation in Nigeria.
He thereby urges the government to adopt community pharmacy as a tool to achieving universal coverage in protecting the people at the grassroots, because community pharmacies are more closer to the people than any other health workers.
We're protecting the people while we're empowering the pharmacists. We're empowering the pharmacists with knowledge, training. We train them on pharmaceutical care, on how to even run their business, because that's another area, on how to make their practice world class. So we do, that's what community pharmacists stand for. We always strive to empower our member in all round, particularly on skill. Second aspect, we have to protect the community, the people. One way we do that indirectly is as we empowered the professional, the practitioner, giving them the right information, right knowledge, updated knowledge, new inventions. They are not absorbing it to keep it themselves. It is to be used for the patient they serve. And that way, they are protecting the community. And we are also doing all of this to protect the community against even, that's another thing that we'll say. All of this I'm talking about here is part of protecting the community. If most of this policy counsel that I give to the federal government, if they are taken, Nigeria will be protected. If Nigeria today has adopted community pharmacies as a tool to achieve universal coverage, the community will have been protected. So, as your community pharmacies is here, we are set on this principle to empower our member, empower them financially, empower them in skills. We do a lot of training, a lot of for them, and also while we are doing all this, we let them know that the community must be protected. You must not take undue advantage of the community.
Dr. Adekola, who makes it known that the community pharmacist has been managing to maintain a good relationship between them and other regulations, such as NAFDAC and Pharmacy Council of Nigeria, which has helped them to render a good services to the community. However, urges all community pharmacists to build the collaborative and protection goals of the Association of Pharmacists of Nigeria.